Hello, thank you for joining me today. My name is Samir Damani, and I'm the CEO and founder of MintHealth. And I'll be telling you about a very exciting project that I'm working on around aligning the different stakeholders in a new healthcare ecosystem. This is highly relevant because historically, healthcare has been misaligned. You have the payers of care and the insurance companies that pay for care, and the providers that deliver the care, and the patients that receive the care that are all different. And more importantly, many times those incentives are not aligned. In other words, if a payer pays out for a particular procedure, they're in theory losing money. And at the same time, the patient may win. Also, if a payer withholds care in some instances, the payer wins, but the patient misses out. So I think alignment is really where we need to focus our efforts over the next many decades as we deal with conditions that are generally behavioral conditions and that are driving 90% of the cost rises. And a token incentive model and blockchain is central to that thesis. So what is MintHealth? MintHealth is an entity that is bringing together existing IP, experience, and blockchain technology. Specifically, we have a verbal agreement, and we are now finalizing exclusive licenses from companies that myself as well as my co-founder have started and are continuing to run and are quite successful. MD Revolution is a patient engagement platform that has engaged over 30,000 patients over the last 4 years. We are a proprietary clinical tool that essentially force multiplies a RN or a health coach care manager with automation. And it's been proven to lower the cost of chronic disease, and in fact has, in the Medicare population in Mississippi, shown that 3,500 patient population was able to generate a $3.5 million savings in reduced inpatient hospitalizations and ED visits in a period of 8 months. And to date, we've raised about $43 million, and the company continues to do very well with respect to the chronic care management codes that have been released. Currently, there are about 4 codes that are active and are reimbursing anywhere between $40 and $150 a month for physicians to provide asynchronous, non-face-to-face care in between office visits. We're also bringing together the license from real key technology from Nucleus Health, which is my partner's company and my co-founders. That is a medical imaging platform that serves currently over 2,400 facilities and 400 hospitals. The IP they have is quite unique in that it essentially renders the need for PACS servers obsolete. And what can happen using their technology, and what is actually happening in many hospitals across the country, is that health systems are now putting medical imaging like MRIs, echocardiograms in the cloud, and actually able to stream that data to a iPad or a web Chrome browser at diagnostic quality in a way that doctors can actually manipulate it to get diagnoses done. It is similar to the kind of blockbuster to Netflix model where, going to the cloud and streaming of information is the future, and the IP that Nucleus Health has will be leveraged in the MintHealth ecosystem and platform. In addition to the patient engagement side and the data side from MDR and Nucleus Health, we'll be layering on a token incentive and a blockchain protective layer for accessing data that's in the cloud, as well as securing permissions. So why is what we're doing important? Right now, we are in the midst of a global healthcare crisis. As you can see, just in the US alone, we're going to go from 2.8 trillion in 2012 to over 5 trillion by 2022. And if you look at the cause of that hike in costs, it's really related to the epidemic rise in heart disease, diabetes, and stroke. And just in Lancet, which is a very prominent publication in 2012, they published that over 40 million of the 56 million deaths occurring around the world were from preventable chronic conditions. And if you look at those chronic conditions, in particular heart disease, diabetes, stroke, about 80%, according to the World Health Organization and the Center for Disease Control, are preventable, about 40% of all cancers. And so just by optimizing risk factors like obesity, hypertension, sedentary behaviors, poor nutrition, tobacco and alcohol use, you can make major impacts on the cost hikes that we're seeing. In addition to the rise in epidemics, there's a demographic shift that is really important to note. We have an expanding middle class across the world. In India alone, there's 300 million pre-diabetics. And in the US, we have an expanding senior population with 3.5 million people turning 65 every year. And so if you really look at the U.S. economy, by 2022, we're going to be over 20% of GDP is going to be secondary healthcare. And this inexorable rise is not going to be stopped unless we start to give control back to the patient and have the patient be in more control of their health, which, as we've heard, is very possible with these behavioral conditions. The other thing to note is that we've really seen a sea change. If you think about the 20th century, the top 5 causes of death were all communicable diseases. I mean, 300 million people died from smallpox alone, and those individuals aren't dying from communicable diseases, they're dying from non-communicable diseases. And so the paradigm of medicine, of treating pathology, has really fundamentally shifted to where now what we have to do is really think about how do we empower patients to really change their behaviors, not when they're in front of the doctor, but at all times. Blockchain can enable, and we'll go into more detail why this is important, is a self-sovereign health record tied to a global unique identifier that allows a patient to control their access to key data points like medication, lab data, data from their apps on their phone like MyFitnessPal, or blood pressure information that they actually generate versus the data generated in a clinical record when they see their doctor, everything from lab data to an echocardiogram to an MRI or an X-ray. And so what blockchain enables is the actual seamless and secure transfer of this clinical and behavioral data between patient authorized stakeholders. And when you layer an incentive model through digital tokens that rewards positive proactive behaviors, now you have an alignment of the system, which I was talking to earlier, where sure, the patient is getting a token incentive that can be redeemed within a closed system, but if the payer is paying for that, and in return we start to see greater cost reductions related to hospitalizations and ED visits, now the payer wins even though they're rewarding patients with tokens. The patient wins because they're healthier, but they're also getting financial incentives that can be redeemed within a closed healthcare ecosystem. And also there's the incentive for the doctor, who can be compensated in tokens for actually performing better at population health. So as you really step back and think about blockchain and this token model as it pertains to Bitcoin and how fintech is being transformed with cryptocurrencies, the reality is that the developed world has actually had quite a bit of confidence in the banking system, where even though it was centralized, if I wanted to send information to another person that was financial in nature, I had a fair amount of confidence that could occur. Today, in healthcare, that's not the case. If I'm a patient that wants to send information from one doctor to the next, or want my cardiologist, Dr. Smith, see an echocardiogram that my primary care physician, Dr. Jones, had ordered, I can't do that. Or if I can, there's many steps that it takes. So it's not real time, and the barriers really put patients into a passive position. So you could argue blockchain is more transformative to healthcare than it has been in fintech, because of the real applications that exist in both developing as well as developed worlds. So what is blockchain? It's essentially a decentralized ledger of all transactions across an open source peer-to-peer network. Using this technology, participants can confirm transactions without the need for any central certifying body. And potential applications include transfer of funds, voting, and many other uses. In this case, it's sending medical data back and forth, and clinical and behavioral information back and forth between patient-authorized stakeholders. So how does it work? Essentially, somebody requests a transaction that is broadcast to a peer-to-peer network consisting of computers, which are also known as nodes. These nodes are then validating the transaction and the user status with known algorithms. The verified transaction, which can include a cryptocurrency, but also contracts, records, or any other information, is then combined with other transactions to create a new block of data for the ledger. And that new block is then added to the existing blockchain in a way that's basically unalterable. And the way that works is that with each block of transactions, there's usually a hash where the mathematical algorithms are being solved. And once somebody finds that mathematical algorithm, there's a consensus mechanism which verifies that that algorithm was correct. And once it's added to the blockchain, it's distributed across all these different nodes, so it's unalterable. So in the case of healthcare, what you have is essentially a global HIPAA log that's auditable and traceable and in an open network fashion. So what can happen, and I'll go in more detail in a little bit, is that you have essentially a system where anybody that wants to access the information would have to be embedded in the smart contract in the Ethereum network. And if they access the data, there is a permanent imprint of that individual on the blockchain, how they access that data. What it does is it essentially takes the group you see on the left with various hospital systems, offices, and different EHRs where data has to go through siloed electronic healthcare record systems, to on the right where patient authorized stakeholders have their data stored in the cloud. And through the blockchain smart contract permissions I just explained, the data is able to flow like water or liquid from stakeholder to stakeholder. It could be different doctors, caregivers, nurses, insurance companies, or whomever needs access to that data. So today, the problem, as I mentioned, Mary's the patient, and on the right you have Dr. Jones here, and typically Mary's data on her own blood pressure, her weight that she's been taking at home is on her iPad or her different app at home or on a piece of paper. She goes to Dr. Jones and she's an obese diabetic with uncontrolled blood pressures, and she has a set of data in whatever flavor Dr. Jones's electronic health record is, and there's over 300 electronic health records existing in the U.S. alone. And so not only is her clinical and lab and medication data in that one EHR, but her imaging data is spread across a different EHR, her billing data, everything's spread over. And then so 6 weeks later, she goes to Dr. Smith, who's a cardiologist, and now Dr. Smith is not able to access any Dr. Jones information because it's typically on a different EHR. Medical imaging is siloed also in a different system. Dr. Smith is not able to see Mary's data from her own blood pressure readings or apps because it's not centralized in a place where she can actually have one place for her own ability to see her own data. And so what that does is it forces patients into a passive state where they see disease as something that happens to them versus something they control. And in a system where you're treating a pneumonia or tuberculosis or 50 years ago smallpox or that might work, but in a system where we need patients to understand their data, be informed about what's going on with them, this system doesn't work. And as you can see from the earlier slides, the reality is it's not working because you can see the cost rises are disproportionate to the rise in GDP of 99% of countries. Our costs in America alone are rising by over 5% a year, and GDP is far lower than that. So what can blockchain do? Blockchain now allows Mary to go to Dr. Jones and using the MintHealth application is able to actually scan a cryptographic key where she's able through an existing integration with the EHR be able to pull data from Dr. Jones's EHR, medication, labs, echocardiograms, x-rays, whatever else is relevant and in Dr. Jones's system into her personal cloud storage, which is protected by the blockchain. So the data is sitting at rest and in transit that is encrypted in the cloud, but on front of it, protecting the permissions is really this open source network where smart contracts are embedded. So if Mary needs to give permissions, she can do it through the MintHealth app and anyone can access it. So several weeks later when she sees Dr. Smith, who's a cardiologist, she can now quickly add Dr. Smith to the actual smart contract permissions and allow Dr. Smith to see the echocardiogram that Dr. Jones ordered, as well as her home blood pressure readings. And she starts to explain to him that she's short of breath. And in that situation, Dr. Smith now is able to quickly look at her echocardiogram images through the MintHealth application and portal. He's able to then eliminate the need for him to order another test, and in real time able to make a decision that, okay, we need to up her blood pressure medication to a twice-a-day dosing because her blood pressures are much higher at night when she's experiencing the shortness of breath. And so over years, months and years, Mary at that point now is growing this data set in her cloud, which becomes more and more valuable because Mary not only is growing the data set, but she's now having more doctors added to her smart contract permissions list. She's able to share the data with caregivers, family members. There's social feeds now that she has on her app, so she's now more engaged with her health. And what this also does, and we'll show it in a few moments, it creates a patient-centered marketplace where entities like Novartis, who we're talking to at MD Revolution about a heart failure program, can come back and say, can we get access to 100,000 patients with heart failure that are on our drug Entresto? And in that situation, patients like Mary can share or not share that data in exchange for vitamins. So the growing data set, and one of the promises of personalized medicine has always been you'd be able to predict who is most likely to have an event. And unfortunately, the promise of personalized medicine hasn't been realized because data has been so scattered. And it's kind of like the whole theory of garbage in, garbage out. If you can't get deep, what I call deep data, where you're not just looking at, nutrition information from a MyFitnessPal app, but you're actually getting clinical information, medications, laboratory information, medical imaging data, home readings around blood pressure, blood glucose, and weight, and combining those and looking at claims information, you can't really start to understand where are the levers we can pull to drive down the cost of healthcare. And so what blockchain allows is it allows for data to be free, where you can put it in an environment that can be queried, and patients are incentivized to do so. And that's the other thing that's really different here, is that the token model can really incentivize patients not only to have healthier behaviors in exchange to get vitamins for that, but it also allows them to be incentivized to put their data in one place. So here's the kind of the model. You can see on the graph on the right all the different stakeholders. The one unique thing about MintHealth is that, unlike many other models, the entities with the deepest pockets, literally the ones that have the most to gain, are those with the deepest pockets. Pharma has a tremendous amount to gain by being able to access data sets that can help drive down the cost of research and development and increase innovation through accessing these deep data sets I talked about. Insurance companies clearly want to have better insight into what patients need to receive, what kind of incentives, and what kind of procedures need to get done. So understanding diabetics in Southern California versus diabetics in Georgia, how are they different? Or understanding pre-diabetics in India, what's driving outcomes in those populations. And so again, the insurance companies, the pharma companies, the med device companies, unlike other industries where, blockchain is disruptive, I would call in healthcare, it's really transformative. And I think that's a really important concept. Not only will vitamins on the left here, you can say, will be used for incentivizing healthy behaviors, but it's also going to be used for the patient to be incentivized to establish that self-sovereign health identity. So if you think about companies like Microsoft Health Vault that in the past, weren't able to really get adoption, one of the reasons why was there was no real incentive for the patient to adopt the Microsoft Health Vault personal record. In addition to that, there was really no tailwind that the government now has in terms of, you've seen the rising costs. Those trends, while we're going in that direction, the sheer numbers now are so big that they have to pay attention. So governments now are looking at ways to do more innovative things around managing the health of populations. And so there are many codes that have come out. MD Revolution, a company that is a company I started and a key foundational partner for MintHealth, is actually leveraging a lot of these new codes and a lot of the new legislation that came out of a bipartisan legislation in 2015 that is MACRA. And then it'll also be used to really compensate provider success. When providers are actually managing patient populations better, they will also be incentivized to do so through vitamins. And the governance and voting that patients are going to be able to do in terms of how their data is used is going to be a critical piece to this as well. So the MintHealth business model initially is that insurance companies are going to be purchasing the tokens and essentially using them to incentivize healthy behaviors on behalf of patients, as well as incentivizing doctors for the health of their patient population. So Mary would get 10 vitamins for completing a diabetes education model. She'll get another 20 vitamins for logging her salt information. She'll get vitamins for picking up her prescriptions on time. Doctors will then look at how their populations are performing and get vitamins there. And at the same time, Mary now can use these vitamins within a closed ecosystem to pay for prescription refills or pay for copays. And so what happens here, again, you can see the alignments there because the insurance carrier is using the vitamin to drive down the cost of healthcare. And so they're able to do this because the return on investment is much larger. And as I mentioned, MD Revolution showed a 5x return on investment using the proven patient engagement platform that we have, and that IP will be exclusively licensed to MintHealth. The other thing I want to really emphasize too is the imaging side of this is critical, where Nucleus is technology around not only being able to move data in general, but in particular compressing and being able to render highly complex medical images at a diagnostic fashion is very important. So those two pieces will be foundational to us being able to drive down the cost of populations and their healthcare. Ultimately, as you look at our rollout, phase one is going to be smaller regional health insurance companies that employ doctors as part of an integrated delivery network. Phase two will be larger national and international insurance companies. And ultimately, phase three is creating an actual marketplace for the data where patients can be remunerated for being able to share their own data. The data can also be shared with any doctor who will be able to use the portal or potentially a web browser to review any of the results. We're really not trying to boil the ocean here. We're really focusing very much on the smaller regional health plans, and then governments are in single-payer health systems in Canada and UK are very critical as well, as they would quickly adopt, as well as organizations like CMS. And we've had initial conversations with a number of chief medical officers of health plans across the country that are expressing quite a bit of interest in the model. So some quick screenshots here. On the left here, you can see how the patient is able to see a CCD document, which is a continuity of care document, which is a standard document that resides within the electronic health record, lab results, CT of a brain. That can be viewed by the patient through the app or the portal, and it can also be shared with any doctor who will be able to use the portal or potentially even a web browser to review the results. And so in this situation, Dr. Smith, who's a cardiologist for Mary, is able to quickly review not only her lab results and her echocardiogram, but is also able to review her home blood pressure readings, which normally wouldn't be part of a normal platform that exists in the electronic health record system today. You can see the next screenshot is really the QR code, which is where Mary's able to scan this and Dr. Jones is able to scan his, and the data transfer occurs. That's where Mary's pulling data into the cloud. The third screenshot is where you see Mary is able to take training modules like controlling her diabetes. She can make a new friend. She can work out 3 times a week. So certain goals, and for achieving those goals, she'll get vitamins. And then there's also ways for her to demonstrate she took her medications. She's been eating healthy, training modules as well, and several contests where she's able to earn vitamins. And then you can see the vitamin balance there. She was able to earn 30 vitamins for achieving her goal. She used 100 vitamins for a prescription copay on the 2nd of May, and a gym membership took 250 vitamins. Here on the left, you can see that the social piece, we've shown time and time again that social networks drive incredibly important behavior change. This is with weight loss, with blood pressure control, heart failure control, all the above. And so you can see that Tyler completed a bike ride. His friend was commending him and asked if he could join. Next slide, you have Alice, who's a diabetic elderly female who is trying to make healthier food choices. She posted a picture of her salad. Tracy Lynn, who's a MD Revolution coach, is now saying great food choice. Love the color in the meal. It's low carb as well. So now she's articulating that she's actually reinforcing positive behavior, but also giving her guidance in terms of being low glycemic index. Also in this demo, you have a rising blood pressure where, Alice has blood pressure that's been going up, and a bot or an actual coach is able to then say, I notice your blood pressure is high. Have you been taking your medications? And so Alice says, yes, I have. I'll continue to log my data to see if it continues to remain high. So again, creating what we call a closed feedback loop, which is really important for ongoing and sustained behavior change. So we talked a bit about the foundational ecosystem partners. Again, talked about the patented streaming technology, Nucleus Health, and also the patented technology around MD Revolution, which has also been shown to drive significant ROI under CMS. And both companies are going to be licensing their technology to MintHealth and will be exclusive in the token space and blockchain space. We have a pretty good team here with highly experienced with over 100 years of healthcare experience. You have on the right T. Green, who's on the board of directors of MintHealth, along with myself. I'm a cardiologist by training. Continue to have a small practice at Scripps here in San Diego. Started MD Revolution, as I mentioned earlier. Vish, my co-founder, is also a physician entrepreneur. Started Nucleus Health. T's background, he's the founding chairman of Greenway Health, which is a very large electronic health record, one of the top 5 electronic health record companies in the country, touching over 75,000 providers and nearly 100 million lives annually. Raleigh Harbor is a seasoned entrepreneur running many tech companies out of Silicon Valley, is our executive lead on our ICO. We have Pat Daly, who's been working in the finance space for over 20 years with Deloitte and a number of other companies as a CFO. And then Gene Balgrosky, who's our CIO, who's a professor of public health at UCLA, but more importantly is a former CIO of some of the largest health systems in the country, Scripps here in San Diego and Holy Cross in the Midwest. We've also sought the guidance from some of the top blockchain companies to date. As you can see here, David Vorik from Saya, Blake Cohen from Salt Lending, Ken Brook from MetaX, and you can kind of take it in here. We also have some key partners from the technology space. Hector Rodriguez, who's the worldwide held Chief Information Officer for Microsoft, is an advisor. And we also have Joe Cavadar, who's a Vice President at Partners Healthcare and heads up their connected health initiatives there. Partners is a $8 billion health system in the Boston area. We also have Jeremy Sohn, who's the VP of Digital Business Development at Novartis Corporation. So we've got a nice mix of advisors around all the ecosystem stakeholders that we're going to need to be engaged with and have been engaged with over the last 4 years, and as well as the key entrepreneurs in the blockchain space as well. So, as summary, MintHealth is a decentralized platform that, again, is focused using tokens to align stakeholders in a new ecosystem around patient empowerment, improving clinical outcomes, and lowering the spiraling costs of healthcare. The platform leverages vitamin tokens to build an economy around health, not disease. We are licensing existing technology to lower costs in caring for patients with these chronic conditions. And we have a seasoned executive team and board of directors. Our initial goal is to raise $60 million in an ICO in first quarter 2018, and we're raising $5 to $10 million currently in a pre-sale. So look forward to sharing more in the weeks and months ahead. Thank you.